Today we're going to be talking about deep vein thrombosis, DVT for short. And what a DVT is that it's a blood clot that occurs in the large vein, typically in the legs or the pelvis area. Some patients may not show any signs of having a DVT, while others may experience pain, swelling, redness, warmth, or discoloration in the affected area. Another classic sign of a DVT is what's called a Homan sign, which is when the patient dorsiflexes their foot, brings their foot to their shin, and they experience calf pain. If left untreated, a DVT can cause serious complications, one of which being a pulmonary embolism, which occurs when the DVT becomes dislodged from where it originated and travels through the circulatory system, through the heart, and becomes lodged in the pulmonary artery. Some of the signs and symptoms of a pulmonary embolism include shortness of breath, chest pain that becomes worse when trying to take a deep breath. The patient might be coughing up blood. They might have tachycardia, hypotension, or decreased oxygen saturation due to the inadequate blood flow through the lungs. Another complication includes post-thrombotic syndrome, which ranges from minor to severe limb swelling and pain. The limbs might also have some skin changes or ulceration. It's really important to assess this patient for hypotension, tachycardia, and their oxygen saturation to prevent a pulmonary embolism from occurring. It's also really important to assess the affected extremity for any pain, tenderness, warmth, redness, or swelling, and then compare that affected limb to the other limb. That way you have a reference of what it normally looks like. You want to palpate to inspect for induration, which helps locate where the blood clot is in the vessel. One of the assessment tools you can use is a D-dimer test, which measures fibrin degradation products produced from a clot breakdown. It's really important to monitor the patient's lab values, especially the PT and INR, because those measure how much time it takes for the patient's blood to clot. If the blood clots too soon, then the patient is at a higher risk for a DVT. And if it takes too long for the blood to clot, then the patient has an increased risk of bleeding. It's really important to monitor for signs and symptoms of bleeding, such as bruising, petechiae, hematuria, or any blood in the stool. Some of the nursing interventions that are really important to implement in this patient would be to encourage early ambulation and to elevate the legs 10 to 20 degrees, which promotes venous return and decreases any swelling in the legs. You can also apply compression stockings, which also help in promoting venous return and decreasing leg swelling. You want to make sure that you don't put any sequential compression devices on this patient, because if the DVT becomes dislodged, then it has an increased risk of traveling to the lungs and becoming a pulmonary embolism. You really want to make sure that this patient is getting adequate fluids, and then administer any anticoagulation medications that the providers have ordered for this. It's also really important to educate the patient about how they can reduce the risk of having another DVT from occurring, such as performing leg exercises, ambulating, making sure that they maintain adequate fluid intake, and avoiding any tight clothing on the legs. You want to educate the patient on signs and symptoms of bleeding, and it's really important that they know the safety precautions to take when they are on anticoagulants, such as limiting any physical activity that could increase their risk of bleeding, using a soft toothbrush or electric razor while shaving, and to immediately report any blood in any sputum, stool, vomit, or urine. And it's also important to make sure that the patient knows to get their lab values checked regularly. Some of the medications to treat DVTs include low molecular weight heparin, such as Lovenox, warfarin, or Xarelto. Another group that can treat DVTs is called thrombolytics, such as TPA, which dissolves existing thrombi and improves blood flow and reduces the risk of the DVT becoming dislodged and traveling to the lungs and causing a pulmonary embolism. But this can only be administered within 3 days of symptoms onset. DVTs are very common, which is why it's so important to know the signs and symptoms and what to assess for in order to prevent further complications.